If you experience a stuffy nose, you're more likely to have it as long as your control pause is less than 20 seconds. So in order to help to improve nasal breathing and to feel easier breathing through the nose, it's important to work on your everyday breathing patterns. Practice the Buteyko method. Breathe through your nose all the time, and this in turn then, your nose will be working better for you. If you do happen to have a stuffy nose, maybe you have chronic rhinitis, so that would mean that your nose is stuffy for about 1 hour a day, most days of the year, or you could have seasonal rhinitis, which is hay fever. So say, for example, for the symptoms of hay fever, you could have watery eyes, itchy throat, stuffy nose, and there could be other symptoms, postnasal drip, etc. The same exercises apply. So whenever you have symptoms, here is a simple technique to help decongest the nose. It's known since 1923 that when you do a breath hold, you help open up the nasal airway. To do the breath hold is as follows. Take a normal breath in and out through your nose and pinch your nose and hold your nose and just gently nod your head up and down as you hold your breath. So you're just gently nodding your head up and down as you hold your breath and keep relaxing into the body as you're holding your breath. You will feel involuntary contractions of the diaphragm and keep going until you feel a moderate to strong air hunger and then let go but breathe in through your nose. Get your breathing under control. Now breathe normally for about a minute or so and then to repeat it. So after about a minute of normal breathing, take a normal breath in through your nose and out through your nose and pinch your nose and hold and gently nod your head up and down as you hold your breath and keep relaxing into the breath hold. You will of course have involuntary contractions of the diaphragm, and as you hold your breath, the air hunger will get progressively stronger. Keep going until it's about moderate to strong. You don't want it extreme. In other words, when you let go and you breathe in through your nose, you should be able to get your breathing under good control within about 2 breaths or so. And then you have normal breathing for about 1 to 2 minutes. If you repeat that exercise 6 times, your nose will be more freer. And the more you breathe through your nose, the better. If you really struggle with nasal congestion, it can be important that during sleep, for example, that you wear nasal dilators, and they are based on what's called the Cottle maneuver. If you put one finger here and one finger here, and just gently prise your nostrils apart, you'll feel that it's easier to breathe. So a nasal dilator that would be suitable during sleep would be the Breathe Right strips, that they help to open up the nasal airway. And also, don't forget about getting your mouth closed during sleep, in other words, wearing tape. And one tape that you could be using is called Myo tape. If you have severe nasal obstruction, yes, the nasal dilator can be very helpful. And also during physical exercise, if you find that your nose is holding you back, that anatomically, that your nose may be a little bit compromised or your nasal airway is small, and this is holding you back during physical exercise, you can also get a nasal dilator. You will see nasal dilators for physical exercise on our website, and they're simply called nasal dilator. The website, of course, is buteykoclinic.com. So, in a nutshell, if you have symptoms of rhinitis, whether it's chronic rhinitis or whether it's seasonal, do your best to maintain nasal breathing. And even if it feels a small bit uncomfortable breathing through your nose during rest and during physical exercise, do your best to maintain that. It's not about pulling and pushing the air in and out of the nose. It's about having comfortable breathing. The more you maintain nasal breathing, the more you practice doing the breathing exercises, you practice decongesting the nose when your nose gets stuffy. All of this combined, your nose will work better for you. And as your nose is working better for you, it's much easier to sustain nasal breathing. Above all else, work to get your control pause to above 20 seconds. When your control pause is increased to above 20 seconds, you will find that your nose is working much better for you. When your nose works better, your sleep is better and your mood is better. There's something extraordinary about the human nose. It serves so many functions, but it is also necessary to breathe in and out through the nose for optimal sleep. If we have the mouth open, our sleep is impacted, we are breathing fast, we are breathing up our chest, and this in turn is also activating a stress response. So if calmness of the mind, increased energy, increased resilience, waking up feeling refreshed, reduced sleep issues, nasal breathing is paramount. And if you continue nasal breathing during physical exercise, you will also see the benefits with that. So good luck with it.